In our previous video, we talked about subclavius, the muscle just underneath the clavicle that attaches from the sternum, sliding underneath the clavicle, attaching, I believe, to the underside and maybe the inside, and how it's going to roll the shoulder in. For people who are experiencing some of the same issues I have with a shoulder that's rolled forward, we talked about women with large breasts, how it's going to roll the shoulders forward. Lots of people experience this slumped forward posture. In addition to subclavius, one of the muscles you may want to check for trigger points is pectoralis minor. The pecs, which are familiar to many people, are the large, broad chest muscles that guys work on when they do push-ups or when they do bench press. Pec major is the big guy, but pec minor attaches at the coracoid process, this bony nodule. If you find your clavicle and then slide down, you'll find this bony protuberance, which is where pec minor attaches. I believe it attaches here, and then it goes down to the third, fourth, and fifth ribs in sort of a fan down through here. So you can see again, muscles do two things. They contract or they relax. If the muscles of pec minor have shortened, people will feel pain in their shoulder as trigger points, sometimes down their arm out to the pinky and ring finger. And the muscles go from the coracoid process again to the third, fourth, and fifth ribs. If these muscles have shortened, what does it do? It rolls the shoulder down and forward. Getting these muscle fibers to lengthen means that the shoulder can open back. The shoulder blade is allowed to roll forward. If you're trying to work on people or yourself and their shoulders are rolled forward like this, it's a good idea to try to address this musculature. Having a therapist do this to you is usually more effective, but as part of your ongoing self-care, it's a good idea to work on these yourself. What I'm going to do is either with a thumb or a reinforced finger. I like the thumb because this feels a little stronger. It's easy to reinforce with a fist like this, so that the thumb joint isn't hyperextended. It's not hurting my thumb. I'm going to come in and find the coracoid process and begin to slide down. Pressing anywhere in here is completely safe. You're pressing into flesh. You can press anywhere down along the muscle. You're going to be pressing into pec major as well. Pec minor is actually underneath, but you have to slide through those fibers. If you have enough softness, you may start to feel the intercostals, the muscles between the ribs as well. As I'm leaning in here, I'm starting to feel a little bit of a tingling sensation down my left arm. I'm hanging out and I'm almost between two ribs with the point of my thumb. I'm going to then take a big in-breath. I'm making sure that my rib cage expands. I'm trying to get the ribs themselves to slightly separate, so maybe I can even get into the intercostals. As I exhale, I'm just allowing my thumb to just gently sink. I don't want to feel too much strain in the hand that's applying the pressure. If it becomes too much, I'll just stop, take a break, use another finger. I'm going to slowly move to another part, and I'm just feeling my way around through the soft tissues. What's going on? When I find a tender spot, I'm then going to hang out there. I have two fingers, not compromising the joints. I can again feel this down almost to my thumb, it feels like. I'm going to hold that spot. I'm in between two ribs again. I'm going to take a big in-breath. And exhale gently. I'm really trying to feel what's underneath my fingers. I'm trying to feel the muscles that I'm working on. I'm going to move just a little bit laterally as that feels more stuck more tender. Ooh, yeah, right there. Then I'm going to hold that. I'm in between the ribs still, but it feels a little tighter. It almost feels like the ribs are more squeezed together there. And I can still feel that down my hand, down to my thumb. And then I'm going to take a break. Anywhere along pectoralis minor, there's no damage or injury that you're going to do. You have to make sure that the fingernails are short. But you can also use a tennis ball if you wanted to hold something more broad over this area. It depends on the person you're working on, or if you're working on yourself. It's something good for women to do to themselves, because I, as a massage therapist, have a harder time getting into this area because of breast tissue. But it's notoriously problematic in smokers and with women with breasts. Very complex musculature. If you get these muscles under your finger pressure and they feel very intense, just go slow. Rome was not built in a day. Let it take its time. You're just trying to get the muscle fibers to lengthen to their normal resting length so that there's movement through here, so that the shoulder blade isn't stuck forward. No matter how much you strengthen the muscles in your back to pull the shoulder blades back, if this muscle is fighting it, you're not going to be able to roll them back as easily. And that's why you want to work on the trigger points through pec minor. You have the same muscle on the opposite side, connects the coracoid process, goes down in little fan lines to the third, fourth, and fifth rib. Work on both sides, even if you're having more issues on one. I'll see you again soon on robertgardnerwellness.com.